My name's Brendan Barnes and I work at EFPIA, which is the trade association for the research-based pharmaceutical industry in Europe. So our members are companies like GSK, Sanofi, Bayer, Novartis, for example. I think the importance of health data for us, we're engaged in developing innovative medicines which are intended to improve people's lives. And what we're seeing now is that with modern health systems, it's possible to capture a lot more information about how medicines are taken by patients and the effects they have on patients. So this really transforms the whole way that we do medicines research and development. Everything from learning about how patients actually take medicines, when they take them, how they interact with other medicines, but also getting back into identifying subgroups of patients who don't respond to treatment. So it's really a transformation of the entire R&D process. So it's creating networks in which data is shared, but also that it's helping to create standards, which is very important because at the moment we have a landscape where there are lots of areas where data isn't shared and where people are unsure about standards. I think GDPR is a key element in this landscape, and GDPR as written is supportive of research. Unfortunately, what we're seeing is that the actual implementation of GDPR is creating a great deal of complexity and uncertainty, and we're keen to work with the Institute to try and address that and bring a little bit more clarity to how the GDPR should work, so it actually provides protections for individuals, but also enables research to take place. I think where we can work particularly with the Institute on GDPR is I think the Institute has played an important role in setting standards, and it has a good reputation there. The sorts of things that we see as being opportunities, and I'll give a couple of examples. One is that there's still a lot of debate about how we should do health data governance. So what the overall sort of framework should be for how data should be shared, how people should be informed about how their data is being used. And I think the Institute has a role there. The other area where I think the Institute can do valuable work is that if we want people to be comfortable with sharing health data, I think they have to see why it's beneficial to do so. And at the moment, we don't have too many case studies out there that's sort of explaining to people this is how the data is used, this is how it's protected, and this is the benefit, this is how it helps research, this is how it helps healthcare delivery. And I think we can do more in that space, and the Institute could be crucial in that. What I think we support in terms of what can IHD do. We support a lot of what was happening. I think the work that's being done around quality standards is extremely important. And for us, what we want IHD to do is to expand and grow and move on to the next level in terms of building robust, secure networks for sharing data. I think we've seen some, in some ways we're still a little bit in the pilot phase in Europe, I think. Things have been created, we've seen they work, but I think the challenge for IHD will be to take that to the next level, so the standards become generally accepted standards and are used in sustainable networks.